Excision of neuroma, cutaneous nerve, surgically identifiable. Digital nerve, one or both, same digit. Digital nerve, each additional digit. The physician excises a neuroma of a peripheral nerve. The physician incises the skin and locates and excises the neuroma in the subcutaneous tissue. Hand or foot, except digital nerve. Hand or foot, each additional nerve, except same digit. The physician excises a neuroma of a peripheral nerve, except digital nerve, of the hand or foot. A neuroma is a benign tumor formed secondarily by trauma to the nerve. The physician incises the affected area in a hand or foot. After locating the nerve with the symptomatic neuroma, the physician excises the tumor. The incision is sutured in layers. Major peripheral nerve, except sciatic. Sciatic nerve. The physician excises a neuroma of a major peripheral nerve. A neuroma is a benign tumor formed secondarily by trauma to the nerve. In 64784, the physician incises the area over the affected major peripheral nerve except sciatic. After locating the nerve with the symptomatic neuroma, the physician excises the tumor. The incision is sutured in layers. In 64786, the physician incises the skin at the back of the upper leg or buttocks near the symptomatic neuroma and locates the tumor on the sciatic nerve. After locating the nerve with the symptomatic neuroma, the physician excises the tumor. The incision is sutured in layers. Implantation of nerve end into bone or muscle. The physician implants a nerve into a bone or muscle to prevent neuroma formation after excision of a neuroma. In bony implantation, the physician drills a small hole in the bone to implant the nerve. The surrounding tissue is brought together around the nerve to secure the nerve to the bone. In muscle implantation, the nerve is sutured into muscle bed. The surrounding tissue is brought together and sutured to secure the nerve in the muscle. Excision of neurofibroma or neurolymoma, cutaneous nerve. Major peripheral nerve. Extensive, including malignant type. The physician excises a neurofibroma or a neurolymoma. A neurofibroma is a tumor of peripheral nerves caused by abnormal proliferation of Schwann cells. A neurolymoma is a tumor of a peripheral nerve sheath. To remove the tumor, the physician incises the skin over the tumor and dissects the surrounding tissue. The tumor is freed and excised from the nerve, without damaging the nerve when possible. The incision is sutured in layers. Excision of chest wall tumor including rib, S. Excision of chest wall tumor involving rib, S, with plastic reconstruction, without mediastinal lymphadenectomy. With mediastinal lymphadenectomy, the physician excises a chest wall tumor, including ribs. An incision in the skin of the chest overlying the site of the tumor is made. The tumor and surrounding tissue are excised. The tissue removed includes at least one adjacent rib above or below the tumor site and any associated intercostal muscles. It may also include rib cage resection and/or an en bloc resection of muscles, including the pectoralis minor or major, the serratus anterior, or the latissimus dorsi. The physician ligates or cauterizes bleeding vessels. A chest tube may be placed to re-expand the lung. The incision is repaired with layered closure and a pressure dressing is applied to the wound. The physician excises a chest wall tumor, involving ribs, with plastic reconstruction. The physician makes an incision in the skin of the chest overlying the tumor. The tumor and surrounding tissue are excised and includes at least one adjacent rib above and below the tumor site and all intervening intercostal muscles. It may also include an en bloc resection of muscles, including the pectoralis minor or major, the serratus anterior, or the latissimus dorsi. In 21603, lymphatic tissue lying within the mediastinum is also removed. The physician ligates or cauterizes bleeding vessels. A chest tube may be placed to re-expand the lung. Plastic reconstruction is done and may involve rib grafts and / or a myocutaneous flap. A pressure dressing is applied to the wound.